Today we are going to talk about primary Sjögren syndrome. This is a rare systemic autoimmune disease that primarily affects middle-aged women. It often shows up alongside other autoimmune disorders like autoimmune thyroid disease, rheumatoid arthritis, or lupus. The disease process is characterized by lymphocytic infiltration that damages the lacrimal and salivary glands. This leads to the most common symptoms: dry eyes, dry mouth, pain, and fatigue. Patients often describe their eyes as feeling gritty, like sand is stuck in them. Their eyes may appear red, irritated, and lack normal tearing. The mouth feels dry and sticky, making swallowing more difficult. Because saliva production is reduced, patients may also struggle with dental issues and discomfort while eating. Sjögren's can extend beyond the eyes and mouth. Lesions may ulcerate and cause pain. The nervous system can be involved, leading to conditions like optic neuritis, trigeminal neuralgia, and sensory neuropathy. Patients might report burning pain in the extremities, numbness, vertigo, or even muscle and joint aches. Raynaud's phenomenon can occur, where blood vessel spasms reduce circulation to fingers, toes, the nose, or ears. In addition to physical discomfort, patients often deal with fatigue, depression, anxiety, and sleep disturbances that may worsen their overall quality of life. Diagnosis relies on a combination of history, physical examination, and specialized testing. Clinicians look for persistent ocular symptoms like dry eyes and confirm them with ocular tests such as the Schirmer tear test or rose Bengal staining. Oral symptoms are assessed for chronic dry mouth. A biopsy of the salivary glands can reveal characteristic lymphocytic infiltration and helps rule out other causes such as malignancy or infection. Laboratory testing looks for specific autoantibodies, especially anti-Rho (SSA) and anti-La (SSB). Rheumatoid factor is present in more than half of patients, and ANA is often positive. Other markers like anti-CCP, anti-centromere antibody, or even circulating DNA may be detected. Skin biopsies can provide evidence of vasculitis, and in patients with neurologic involvement, nerve conduction studies, MRIs, and cerebrospinal fluid testing may be used to clarify the diagnosis and guide treatment. There is currently no cure for Sjögren's syndrome, so management focuses on relieving symptoms and improving quality of life. Artificial tears and ocular lubricants are prescribed for dry eyes, and topical cyclosporine may help with inflammation. Pilocarpine drops or punctal plugs can increase or preserve tear flow. For dry mouth, pilocarpine is often effective in boosting salivary production, and Biotene oral rinse can provide comfort. Patients are advised to eat small, frequent meals and avoid foods that are spicy, salty, or otherwise irritating. They should also avoid smoking, alcohol, and medications with anticholinergic effects, as all of these worsen dryness. In some cases, advanced therapies like rituximab or interferon may be considered, though the evidence is still evolving. Because depression and sleep disturbances are so common, patients should be screened and referred for mental health or sleep support as needed. Nursing care emphasizes education and reinforcement of self-management strategies. Nurses play a key role in helping patients understand how to use ocular treatments correctly, since improperly managed dry eyes can lead to infections. Because pain, fatigue, and mood changes can interfere with learning, nurses must assess readiness and adjust teaching accordingly. The overall goal is to help patients manage their symptoms effectively, prevent complications, and maintain as much independence and quality of life as possible.